Hi everybody, we're back in God's country, El Paso, Texas for a great show on healthcare reform. This issue is hot all over the United States, but particularly right here in El Paso, Texas. That is ground zero of the uninsured in America today. We've got a great guest with us, my good friend Joe Luna, Dr. Joe Luna, the medical director at Centro San Vicente right here in El Paso, Texas. And today we're going to talk about health care right here in El Paso, Texas. Doc, welcome to the show.
Oh, thank you, Senator. I am really honored to be here on the show with you.
I've got to tell you a little secret, family secret. My daughter's a second-year medical student at Southwestern Medical School over in Dallas and was doing rotations at La Fe and also at Thomason this summer to get a real bird's-eye view, an on-the-ground view of healthcare right here in El Paso. But you've been doing it for decades now. Tell us, from your experience, what happens when someone doesn't have health insurance?
Well, the simple truth is we can talk about a comment made by an ex-governor of Alaska by the name of Sarah Palin. She talked about death panels. I'm going to change that a little bit. And I want the audience to understand something that I've been working on for the past 27 years. It's called a death list. People who are uninsured, and this has been proven over and over time. There was an article by the Institute of Medicine in early 2002. It was again quantified and verified by the Urban Institute, is a nonpartisan think tank, which stated this: of the uninsured people between the ages of 18 and 65, just by the mere fact of not having health insurance, you increase your chances of premature mortality by 25%. Senator, I think in the United States, in America, that is unacceptable.
Talk to us about other countries. If you looked at Canada or Britain or any of the Western European countries like France or Sweden, some of those countries, what is their healthcare system? What are their outcomes? How do their patients fare for the price and the pay, the money that they've got in their healthcare system today?
Unfortunately, that's one of the things that saddens me, is that the United States is the only industrialized country in the world that does not provide health care to all its citizens. If we compare our healthcare systems to, let's say, England or Canada, their outcomes for many things are much superior than the outcomes for our citizenry. For example, our neonatal early births are much more improved in those countries. The mortality rates are a lot better in those countries. The mortality rates are less in those countries. So for what the price they pay for the health care, we just can't compete. Something is wrong. Something is definitely wrong in how our healthcare system is working now.
Let's talk about real people in the different neighborhoods of El Paso. Say a mother of two, and she's working as a secretary in a small business. The business owner has said, you know, I can't make the payments for your health care. It's too much. I can't make the hundreds of dollars that it would cost to keep you covered. And so she goes without. She's 27. Her kids are in first and third grade in school. What happens when that child gets asthma? What would happen if that child had a health insurance policy and had access to preventative care, for example?
Okay, let's go back. The very first thing is being uninsured. The sad part about it is that, unfortunately, the majority of patients who are uninsured use emergency rooms as their default primary care home. And this has been verified. For example, just recently out of in Houston, they did a study. 50% of the visits by the uninsured to hospital emergency rooms were for non-urgent care. That is, they use it as a primary care home. Unfortunately, that is causing our economy to suffer. Emergency room care is almost 10 times higher than we can provide in the outpatient system. Once patients go to the emergency room, for example, not only for asthma, they are sicker. For diabetes, they go at the end stage when they might need dialysis, they might need hospitalization for an amputation. Where if we had a preventive healthcare system, which is a less expensive system, we could treat them as an outpatient. Not only could we save lives, but we could save millions and millions of dollars.
So if we got them covered, we could give care at the earliest stages for the least cost instead of care at the highest cost on the local taxpayer's dollar.
That's exactly right, and that's very, very important. Let me give you, I've been doing this, I've been working on healthcare reform for 27 years, Senator. One of the most important things is something called uncompensated care. we all end up paying for it, whether you have insurance, where you're a worker. Every American citizen pays for uncompensated care. In the state of Texas, the uncompensated care costs in a 5-year period went from approximately $5.5 billion to almost $11 billion. That increase in uncompensated care increased premium rates for those who have insurance by about 50%. That means people that do not have insurance cause increased charges in the hospitals. The hospitals have that uncompensated debt. And somebody has to pay for that. And it's all watered down, and we all end up paying for it.
So here's what happens. Someone's uninsured. They go into an emergency room. Care is provided. They can't pay. And so what happened is the hospital, trying to recapture that cost, looks at the folks that do have insurance, raises the premiums, so the uncompensated care is redistributed to those that do have insurance.
Correct.
Who have a hidden cost in their insurance policy.
Yes, sir.
Let me talk about something, because I don't think a lot of El Pasoans know this. I go all over the state of Texas. I've been in nearly every city in the state, large city for sure. When we talk about El Paso, in the entire country, there's not a city that has fewer people covered with health insurance in the entire country than El Paso, Texas. There are on the order of 250,000 people here in El Paso that don't have health insurance. In Texas, there's about 5.7 million. One of the things I hear on the streets is folks say, well, that's the immigrants.
That's
incorrect. Let's not worry about them, that's immigrants.
Mm-hmm.
What are the facts about those that are uninsured, both here and in Texas?
The facts of those that are uninsured is that the vast majority are U.S. citizens. They are Americans, the vast majority. The other thing is that the people who are uninsured, the vast majority, up to 70%, are fully employed. They do not have health insurance because they cannot afford the expensive premiums that have gone up 50% because of the uncompensated care. One of the other things I was going to say is that this is amazing. We almost have 6 million uninsured people. This means we have more uninsured people in the state of Texas than 34 states have of their entire population.
You know, I was looking at those numbers today that you sent me and we're working on, and of the almost 6 million, it's about 5.8 million. Of those, 4.1 are citizens of the state of Texas, 4th, 5th, 6th generation Texans who don't have health insurance. And that to me is something that is frankly immoral. To say that every other country can achieve some sort of universal health care and has probably had it for 60 years since World War II, yet this great nation cannot achieve a health care program that covers its citizens, to me is unacceptable.
And I agree with you, Senator. You know, as a physician, and I took an oath many years ago, and I've been working it a long time. May I go back to you then, Senator, and say, you've been in politics in the state legislature. What can we see from the legislature, from your point of view?
Well,
how can we address this issue?
I'm going to be honest. I think the state of Texas, with the current leadership is so far right that the right hand forgot what the far right hand is doing. And Texas now spends 50th. We're last in the country on what we spend on our own citizens. So whether you're talking about schools or you're talking about colleges where tuition's going higher and higher because frankly lawmakers will not do the hard thing, which is to fund these programs, you're not going to see any help at the state level with respect to increasing those that have health coverage. Rick Perry, this last session, we got out of the Texas Senate on a 29-2 vote. So 29 senators. That means the majority of the Republicans and all of the Democrats voted to increase and expand CHIP. CHIP's the Children's Health Insurance Program that covers low-income kids. And the governor, when he saw that vote, said, don't need to take that to my desk. I will veto CHIP if it gets to my desk. That is what Rick Perry said back in June of this year. So I don't believe he really has a responsible view of what to do. And frankly, I think his talk of socialized medicine and the kinds of scare tactics that he's been using for so many years are falling on deaf ears. When you look at this claim of socialized medicine and the government paying for medicine, what would have happened to every single veteran at Fort Bliss when they were on duty or when they were finished with their military service if we didn't have the government paying for health care? The government's been paying for health care for decades. Let's talk about the ways to make it work even better. That's my view. And frankly, I think this is an historic moment with President Obama. We've tried 5 times since Truman tried it in 1948. And to me, we simply must achieve success and get Americans covered with the universal health care system. That's my opinion.
And it makes sense, and it makes sense not only from my perspective, not only from an economic model that providing health care not only reduces costs but improves lives, but from a moral and ethical perspective that we know and it's been verified. And again, I reiterate that not having health insurance for those people between the ages of 18 and 64 increases their chances of premature mortality by 25%. I hope that's not your aunt, your uncle, somebody's niece or nephew, because that's a reality. That's a reality. And that's the death list that I talk about. And I've been talking about it for years and years.
Let's talk about those that do have health insurance, because that case has not been made. People aren't really talking about that. But the need to get people better insurance and lower costs in medical care. When a person has a commercial private pay insurance policy, what amount of that money is going into actual direct health care? If you had $1, how much of that dollar is being paid to the doctor or the hospital or the guy that ran the colonoscopy, as opposed to who did the denial management or the administration?
And I understand where you're going, Senator, and I agree with you in terms of administrative costs. I can tell you right now, insurance companies are, in Texas, I think the latest statistic is that the insurance industry is very, very healthy. I think the Texas Department of Institute has over 700 licensed insurance carriers in the state of Texas, and they are all extremely, extremely healthy. The question is, at the present time, I'll ask our audience, I'll ask you, people who have insurance right now, if you have several of these products called managed care, who's benefiting from it? A lot of the times it's not the patient. I want the patient to really ask themselves when they went to the doctor, were you able to fill the prescription that the doctor wrote for you? Were you able to go to the specialist the doctor sent you to? Were you able to go to the hospital that your doctor works at? And I think the answer is to a lot of people, no. A lot of the health industry right now is managed. They tell you where to go. They tell you what medicines to take. They tell you when you can take a CAT scan or a CT scan. And now I want our audience to look at be introspective and say, has that happened to me?
Well, let me follow this dollar, because when this information was revealed down in Austin, it's shocking. So let's follow the dollar. If you have a commercial pay insurance policy, so you go to Blue Cross Blue Shield or Aetna, and you say, I want to get covered and I'm willing to pay a premium to get covered, what actually happens to that dollar? The answer is about 28 cents goes into something called denial management and administration. So the company is paying folks who sit and whose job it is to deny you health care, to either find a pre-existing condition in your application and say, so sorry, we did not know, or you filled out this blank wrong, or you lied about it, which oftentimes is incorrect, and in certain cases even paying bounties to rescind the policy and tell the person, so sorry, not covered. In other words, they're hiring people with your dollar to kick you off of your health insurance. Folks don't know this out there. 29 cents is going into denial management and administration and media. That's that health dollar. Now let's contrast that with, say, Medicare. Medicare is the program that takes care of the elderly in our great country. It's one of the most popular programs in American history. How much of that dollar is going into directly paying the physician for the good work that he or she is doing, or the hospital, or that colonoscopy, or that test that you're going to need to diagnose maybe a heart condition? The answer is 5 cents. On one hand, you have 29 cents going into it, which is denial management and profit, and on the other hand, you have 5 cents. That's why it's so important to maintain the option for those to seek that public option policy so that they can lower the cost of their health care.
And I agree with you 100%, Senator. A lot of people don't know this, that if you talk about government-run health insurance, they have the lowest administrative costs.
Here's a topic that's come up a lot. You've mentioned Sarah Palin, no longer the governor of Alaska, but she did a Facebook blog about death panels. And as an attorney, I've spent a lot of time with many, many different clients who've come in to say, I want to talk about my end-of-life decisions and signing the documents so that my choices are honored in the hospital. How does that work?
Well, this is how it works. First of all, I think that Facebook or the Twitter, what you did it's I guess, bogus. Just a scare tactic. There is no such thing written in this legislation. I have been doing this for 27 years, and I think all physicians need to do it with their patients. We need to counsel them on the end of life in terms of their wishes, what they would like. We talk about resuscitation, and that's something that I have been doing all my life, and I think all physicians were trained to do that. The only aspect of this bill was that doctors would be compensated for their efforts in discussing this normal doctor-patient relationship that should be done with all our patients.
You know, the president has talked about his goals in this legislation. This bill has gone through one committee. There's others working their way. But I think he's made it very clear about what his goals are and what the country needs. The first is we've got to lower the cost of health care. When there is an incentive, as there is in many hospitals, and we're going to talk about a couple here in El Paso, to maximize profit, we get something called overutilization. The cost of care goes up and up and up because too often tests are asked for and ordered when they're not really needed because they're going to maximize profit and not patient outcomes. What is your perspective on what systems really work the best in terms of patient outcomes?
I think right now the trend that's recommended by different